Hey, Ameena. Hey, Jess.
Good morning, guys. Good morning, Julie. Good morning, Jess. Welcome back from holidays.
That's it. We hope you had a good time. So we're going to jump in to give you a bit of quick assistance with the topic you raised just prior to going away, which was how can we get the recall patients to actually commit and turn up to those appointment times that are pre-booked prior to. So Ameena and I see this as a three-step process. If the first two steps to the process aren't done effectively, your ability to get that patient to actually turn up to that appointment time, the third step, won't be that successful. So step number one, go for your life, Meanie.
So step number one for me starts in the surgery with the clinician and the patient. So I think the patient education aspect is very, very important. I think creating visual guides and a reason to return is very, very important. So from the clinician's point of view, making sure they've got good visual aids such as intraoral cameras, photographs, all that sort of thing is really helpful. For example, if we're just got a patient who builds up a lot of calculus and they see a before or after, it has a lot of impact in comparison to just being told or having it removed. They can't really understand. The same with perio disease, having a chart, maybe printing it off and giving it to them so it actually means something, showing them what you're doing with the probe and what that's all about. Get them to hold a mirror so they can understand exactly what's going on. And then they also need to understand the consequences if they do nothing about the treatment. Then they can make some really educated decisions.
Absolutely. And those repercussions, that's the selling feature of not just the recall visits, but for anything that your practitioners recommend to the patient. With all of our education in our dental brains, we know already why this person should come back for the next appointment time, no matter what it's for. The patient doesn't have all that information in their brains. So really encourage the practitioners to speak out of their mouth all the things that are going through their head and really try to go from these are the conditions I'm seeing, so therefore this is the treatment I'm recommending. Put something in the middle there. These are the conditions I'm seeing. And if this does get left without any treatment, these are the ramifications I'm fearing I will see roll out in your mouth. And so from a recall perspective, that could be, as Meanie said, a lot of tartar buildup. If we don't get on top of your 6-monthly recall appointment times, that tartar buildup gets worse. And then the gums become very inflamed and then we start losing bone and all the things. And so you start talking about all of the ramifications and you hold yourself and the patient there in that time without instantly providing a solution around it. So don't go from this is your condition, therefore this is my recommendation. Go from this is my condition, this is your condition, this is the ramification, and hold it there. And if the patient starts asking, gosh, what can I do to prevent that? That's where you can say, that's why your 6-monthly appointment time, that it's so imperative. And try to get out of the terms 6 monthly as well. We're in the month of January right now. So instead of saying, so we'll make sure we book you in 6 months, there doesn't seem to be any importance or urgency over that. Rather say things like, I've noticed the level of tartar buildup since we last saw you, or I've noticed the gum inflammation that I've seen there. And during the examination, I've highlighted to you, there's a crack on this tooth, there's a heavily filled tooth over here. We want to keep an eye on that because what I can see happening in the future is that filling breaking down always happens at the worst time. You're going to break and you won't have time to come into the dentist. We want to make sure we prevent those sort of things. So talking about all the conditions and the ramifications, and then say, so to make sure I keep an eye on all of this, I want to see you in July. And all of a sudden, that's got a little bit more importance and urgency over getting that appointment time done in July.
The other thing, sorry, Julie.
No, go.
The other thing I'll mention is that often these discussions happen when the patient's in a vulnerable position, lied back in the chair, and with a nurse and a dentist hovering over them. It's quite intimidating, and they're perhaps a bit anxious. It's very hard to absorb information, isn't it? So if you're not already doing so, sit the patient up, get the clinician or the nurse to remove their gloves and masks, sit eye to eye with the patient and discuss it with them so they're in a safer zone, so to speak. And as Julie said, be very specific about those numbers I was calling out to the dental nurse. They were, periodontal pockets, and if we don't treat them, this is what it could look like moving forward, but we could possibly turn this around and manage it well and prevent those sorts of things from happening.
Yeah. We're trying to get away from saying to the patient, in essence, this is the messaging the patient often gets, I'm fine for another 6 months. We don't want that because that 6 monthly appointment time can then be put off to 7 months, 8 months, 9 months, because the patient thinks to themselves, everything feels fine. Everything feels fine. And so when the patient during the examination process is being educated that once you feel pain, once there's a breakage, that's actually gone too late. That means things have been rumbling along and neglected for such a long time. Now you're actually experiencing discomfort and pain. That's what we're trying to avoid. When we want the patient to fully understand, I may not be feeling things going on. I might not be feeling that little groove develop into a slight decay. I may not be feeling my gums becoming inflamed. I may not be feeling the tartar buildup on my teeth. That doesn't mean everything's 100%. And so we need to go through that process of making sure we're saying to the patient, all the things that are going through our brain, that if I came into that surgery and I said to you as a dentist, if this patient was never going to come back to you again for another 5 years, would you be happy with that? And you would say, no. And I would say, why? And your answer to that why are all the things you should be telling the patient in a really clear way. So in the surgery, you're building up the sense of importance and the sense of urgency for that recall appointment to be happening in July. The patient wants to turn up in July because they're very clear about the ramifications they're trying to avoid. And so therefore they don't want to delay it beyond July. And so that's the second step of this process, which is the patient handover from the clinician to the receptionist. And this is where this is the ideal. Some practices can't or won't do the ideal for very good reasons. And so modify it to what's going to suit you. Ideally, it's the dentist. It could be the dental assistant. It could be the patient bringing out a little patient handover sheet that has all the information that we require. And I've got one of them here somewhere. I'll find it. The information that's required is this. So in an ideal scenario, receptionist, Ameena, I'm the dentist, I come out. Ameena, we've finished seeing Sally for today. What we did today was a checkup and a cleaning. We are looking at making sure the gum inflammation I noted isn't getting any worse. And there's also a cracked tooth on the other side that we also want to make sure isn't getting any worse. And so I really want to see Sally in July for a 45-minute appointment time for her checkup and cleaning. And so now Ameena, as the receptionist, has the information she needs to effectively communicate the sense of urgency and importance over that recall appointment time to the patient, because quite often this is missed, isn't it, Meenie?
Yeah, and ideally the patient standing in front of the receptionist when the dentist is giving this message to the receptionist. So they're hearing it in the surgery from the dentist, and then they're hearing it again from the dentist in front of the receptionist, and then they're making the appointment and getting it all confirmed with the receptionist. So they're getting the message 3 times loud and clear that there's a concern and the dentist wants to follow up on that, and not just in 3 months' time or 6 months' time, but saying the month is a really good tool to use. It's an impression in their brain that,
yes, July, not 6 months, 6 months, 6 months. I think about it tomorrow, next month, it's still 6 months down the track. Yeah. And the common scenario when we don't have that effective handover to the receptionist is the receptionist just says, the usual handover is the patient's right again for another 6 months. Oh, great. I'll book you an appointment time in 6 months' time. By now the dentist is gone and the patient says, no, I'll give you a call. Okay, no worries. Give us a call then. If the patient tries to do that, which is, I'm saying tries to do that, like they're trying to get away with something, that's not what I'm saying at all. If the patient should say something like that, that's where the receptionist says, no problems at all. just to make sure that we do get you booked in July. If I don't hear from you in a month, what if I give you a call then and we can make sure that time is scheduled to make sure that we get those areas looked after. And without that information, if the patient was just to say, I'm not going to book an appointment time right now, the receptionist doesn't have the information to be able to all of a sudden inject importance and urgency that she has no idea what it's about. Were you about to say something, Meenie?
Yeah, and I think the other thing is, depending on the day's procedures or treatment, the dentist could also say, I'd like to see so-and-so in July for such and such to check on this particular area. And could you please call, Sally, for example, tomorrow to follow up after today's treatment. I just want to make sure that she's comfortable and it's all going well. So they really get the message of their whole treatment is of somewhat importance.
Great, terrific. And just as a bit of an example of a patient handover sheet, this is something that can be templated out, printed on an A4, cut in 4, have these bits of paper at reception, in the surgery. This is the sort of thing, if you don't normally hand over the patient to reception or you don't see yourself doing that in your practice, then at the very least fill this out in front of the patient, discussing it with the patient, hand this to the patient, they receive it, take ownership over it, and then they hand it to the receptionist. So there's still power in that, but ideally it's going to be the practitioner handing over. And so this is a bit of an example of it. You've got the doctor and the patient name at the top because these are always useful to hang on to, but also hand back to the patient. I'll tell you why in a minute. So what we completed today is we got this stuff done today. The next treatment is whatever the next treatment is going to be, 6-month recall, the length of the appointment time I need, the ideal timing of that next appointment time. We are avoiding, that's the ramifications, write that in because, and you can have other notes under there as well. There's another version I've got that's got the appointment time, the next appointment time listed there. I'll make sure that we send that through to you, Jess, because that's when if the patient actually books in, write the appointment time in there too, and then scan this into the computer quickly, hand it to the patient. They'll always be reminded about the ramifications. So when they're thinking about delaying their recall appointment time, they've still got that information right there. And it's interesting, if you even got, this is going to a step deeper into psychology, if you got the patient to actually write down their appointment time themselves, it's something like 80% more likely to turn up to the appointment time. That's what studies by Robert Cialdini have indicated, because they are stating a commitment to you and they are more likely to go ahead and keep that commitment to you. Given those two things are done really well, you are already far reducing down the chances of your 6 monthly pre-booked appointment times not turning up, because now the patient wants them as well. And the patient has a sense of urgency about them as well. And so that's when you have a confirmation process that makes sense, that's not harassing, that's very clear. And what confirmation process do you normally recommend for a 6 monthly pre-booked recall, Meenie?
So I think 2 weeks before sending an SMS, just an appointment that was made months ago, just alerts them, 2 weeks time. Does that still suit in my diary? Have I, double booked myself or anything like that? Make sure that all works. That gives them ample opportunity to do something about it, cancel, reschedule, whatever. And it gives the practice time to fill that spot. And if within a couple of days they have not responded to the SMS, I'd be calling to say, I sent you an SMS to remind you of your appointment at this time. I know you made it quite a while ago. Does that time still work? Can we expect to see you? That sort of thing. And then again, you've got the opportunity not to have a late cancellation or FTA. And then 2 days before, just sending a friendly reminder, just reminding you, or we're looking forward to seeing you at such and such a day and time. And yeah, if, they've all responded and confirmed, that's fine. If not, following up with a phone call.
I agree. And just make sure you keep a couple of things in mind when you are sending out SMSs a couple of weeks beforehand, because I think, Jess, we as a threesome did speak about this at some point. Most people don't actually open up that message straight away. They read whatever is in the little notification alert that you've got an SMS. So it's in there that you need to put in 2-week reminder, or you have, dental appointment 14th of whatever. So they are aware, oh, it's not this week, it's not next week, it's the week beyond that. So do be mindful of what your very initial part of that text message is. I agree with Ameena. I love sending an SMS and getting that, because the other thing too is 2 weeks prior to, if they confirm that appointment time, I take the confirmation out. So I ring them again or text them another text message the day before, 2 days before is better, because as Meenie said, you want time to fill that spot if they're not going to show up. I'm not satisfied with just that 2 week prior to reminder. So put in your system a different way of identifying this person did get the 2 week reminder. And then again, we're contacting them again 2 days prior to remind them, because our lives are very busy and people do absolutely forget. And I do like the wording that you use, Meenie, rather than I'm confirming the appointment time, we're looking forward to seeing you at this time as well. Were you about to say something?
Yeah, you can have a couple of different statuses. From memory, you use Dental for Windows, so you can have a couple of statuses in there for the, one could be the 2 weekly confirmation, and one could be the reminder 2 days before. Also, what was the other thought I just had? Left me.
Gone. Hopefully, jump in if it comes back to you. Do you want to say something else? Go.
No, go.
And the other thought that I had, because you were saying that some of them, they don't even respond to any of the SMSs or the messages, the phone calls, the anything else. What I tend to do is the 2 days prior to, or if they haven't responded to the 1 2 weeks prior to, then all in the one kind of couple of minutes, send them an SMS, ring them straight away. It'll be a missed call, leave a message, then send them another SMS with different wording. So they're getting that sense of urgency to respond to you, just because they're like, oh my God, these people are like, there's something must be going on with my appointment time, because they're contacting me so often. And so think to yourself, what would my response be? What would it take for me to quickly call back the minute I've got an opportunity and do that for them? If there's still no communication, this is an area where I feel like it's, as long as it happens rarely, and when you do the figures, usually it is very rare. There are some practices that I've worked with that have this as a regular problem, but it's because they haven't had the other 2 steps sorted that this can become a problem. They do things like book the 6 month, they pre-book the 6 monthly appointment time, regardless of whether the patient's done it or not. And then they're trying to confirm this appointment time that the patient never actually booked themselves. There's other issues going on. But if you've done step 1 and step 2 really effectively, you've engaged the patient in the surgery, you've done a great handover to reception, and they're not responding to the confirmation, it will be a very few number that don't turn up to that appointment time. I would not double book that appointment time. I feel like if you double booked it, you're likely booking it with a patient who does turn up to their appointment times, one of your ideal patients that you want to build your practice with, and the likelihood of 2 people turning up at the same time is high. And then who looks unprofessional, who looks disorganized, who looks like they're letting somebody down, if not both of them, it's you guys. It's not worth it. Use that time to get patient notes written up, do a bit of team training, watch one of our club lunch and learns, Ameena, do something useful with that time and just say, that's okay. We'd rather have that dead time for half an hour, rather than indicate to one of our great patients that we haven't got it all together. Would you agree with that, Meenie?
Absolutely. And with the SMSs, that's what I was going to say, is that it is very limiting the text that you can put into the messages when you're setting them up. So, you have to choose very wisely the words you use and how you use it. But I really like Julie's point about the first few letters even being bold or, capitals or whatever, with that clear few words to describe what the message is going to be about.
And I've just had an additional thought too, Meenie. If there was a pre-book recall and the person just was not getting in contact, what do you think of maybe the 3rd or 4th SMS try that you send them through an SMS of modify appointment here, and you provide the booking link that, if you have Health Engine, for example, you provide an easy way for that person to indicate they're actually not planning on coming at all. And so they can cancel their appointment time or reschedule it via the booking link, because that's what we want to do. We want to make it as easy as possible for people to let us know they can't make their appointment times. Then that gives us all the time that we need to be able to fill that time.
Yeah.
Yeah. Beautiful. And through the program, I don't know if you've learned this lesson yet or not, Jess, but there's a thing called Text Expander. If you haven't heard about it, then just reach out. Actually, we can do it during the live sessions that start next week. Text Expander is a way of getting these sort of additional little messages systematized, such as this is easy to cancel SMS you want to send through. You can template all those things. So all you're doing from your end is hitting a couple of keystrokes, which is the little abbreviated code for that message you want to send through. Makes it nice and quick and easy. You don't have to spend a couple of minutes trying to remember and find the link and do all the things. And so we can certainly go through that with you. Is that it, Meanie? We hope you're successful with it. We hope this has been helpful. Reach out if it hasn't been helpful, and we can continue to work with your practice to make sure it's not such a big issue anymore. I'll speak to you soon. We'll see you Monday, hopefully. See ya.
Bye.